It's certainly a busy time here at AHIP with lots of activity in the air. We've heard many presentations during the course of yesterday and this morning talking about change in the industry. And today I want to focus on what we see as a very important part of change, and that's the emergence of consumer power into the market and how that will begin to change what we have to consider as we participate in supporting our health plan customers. My name is Frank Hone. I head up engagement strategy services at HealthX. HealthX is a cloud-based software solutions provider for health plans. We're based up in Indianapolis. We've been in business since 1998, serving initially the TPA market, and now more increasingly we're involved in the health plan market. And strategically, we're focusing a lot of our attention in our roadmap planning and business development around healthcare consumerism and services that focus on the consumer and their needs in the market. My own background prior to coming to HealthX at the beginning of the year was as Chief Engagement Officer at HealthCentric Partners. We're a engagement strategy and marketing consultancy. And then prior to that, I was Director of Sustainable Engagement at Healthways here in Nashville. In 2008, I wrote a book about healthcare in the U.S. called Why Healthcare Matters, How Business Leaders Can Drive Transformational Change. And this book was written as an employer's guide to healthcare consumerism, a topic that in 2008 I really felt had great future growth potential. I really felt that consumers could take better advantage of monitoring their own health and improving their own health care if they were given the right tools and expertise to do so. So I think that's even more true today. Prior to my work in healthcare consumerism and engagement strategy, I spent 25 years in consumer advertising and healthcare marketing. And part of my charge at HealthX is to bring that perspective of consumer marketing and engagement strategy into our customers to help them better connect with their members. So here's the headline: consumers are coming. I think this is something we hear consistently in presentations, and we see at the booths around the exhibit hall here. It's something we're aware of, but it's a long time in coming. So we're all consumers, or patients, or members, or employees. And as such, we've really been at the receiving end of a healthcare system that is supply-side dominated. So the payers, the providers, pharma, and the regulatory groups that oversee them have been dominating what goes on in the healthcare system. The reforms we saw that were attempted in 1993 with Clinton were really designed to reshape the supply side. Even a lot of Obamacare focused on the supply side and how payments are made, although there's more of a consumer dynamic going on there. But we're seeing a gradual shift from the supply side to the demand side, even though we as individuals are generally unempowered to do much. I mean, how many of each of us gone into the doctor's office and filled out another 7 pages on the clipboard, even though we did it on our last visit? Or forced to walk into an exam room and strip and put on that paper gown? We're not really thinking about the consumer as somebody we need to satisfy, but rather somebody we need to serve. And that's going to change. We've seen over time some significant efforts. The AIDS movement in the 1990s really brought a new appreciation of that disease and sparked a lot of innovation in drug development. We continue to see the breast cancer advocacy by Susan G. Komen and others bringing new appreciation of that disease and new care for that. Last summer, the ALS Bucket Challenge was something that got all of our attention and brought attention to ALS. But as individuals, we've really largely been unempowered to do much in responding to what the healthcare system has to offer. Now, the fact that consumers are coming is really no newsflash, and the industry's been at this for the past decade. We focused on healthcare consumerism as a key component of what part of the healthcare system represents about 10 years ago. Ron Bachman, one of the early innovators in that space and a continued leader, talked about healthcare consumerism in this way. He said, healthcare consumerism is about transforming a health benefit plan into one that puts economic purchasing power and decision-making into the hands of its members. It's about supplying the information and decision support tools they need, along with financial incentives, rewards, and other benefits that encourage personal involvement in altering health and healthcare purchasing behaviors. So this was a decade ago, before there was much in the way of incentives, before there was much in the way of decision support tools. So it was a vision, and it's a vision that's starting to come to pass. In fact, over the past decade, we've seen a number of trends feed this area of interest in consumerism. There are trends that have begun to shape change, but have and still have great potential. We saw the emergence of consumer-directed health plans in about 2005, around the same time this whole trend began. They got off to a slow start. Health plans did not really provide the right kind of information and guidance to the brokers and employers that bought the plans. So it kind of went on a slow trajectory in the beginning, then the recession hit. But now we're seeing consumer-driven health plans paired with an HSA represent about 20% of employer-sponsored health plans. So it's a solid base from which to work. Wellness has experienced tremendous growth over the past 7 or 8 years. It's moved this health promotion inside employers into a kind of fairly exciting, for some employers, means of focusing on culture, changing behavior, performance and productivity. It has gotten millions of Americans more focused on their own health from the standpoint of what they can do about it. Today, about 80% of employers offer some kind of wellness program, yet it is under a bit of a cloud. The ROI questions around wellness, give it some questions as to how sustainable it might be in the employer setting. Yet it has given people a chance to experience change on their own. Medical tourism is a cornerstone element of healthcare consumerism. Each year, about 1 million Americans travel outside the US to Singapore, Dubai, Mexico, a number of other countries for elective cosmetic, dental, or medical procedures. They have decided to reach into their own pockets and not buy what's available here in this country, but find alternate solutions in other locations or in other places inside the country. It's not just global. And then price transparency is an area that we're seeing some strong interest in. We've got some exhibitors here that are focused in the area of price transparency. It has become a hot topic. Certainly in the IPO market, when Castlight went public, was a big story. CMS has helped fuel this with their release of data 2 years ago on inpatient and outpatient procedures. And so that has helped provide another impetus for data to be in the market. Last week, they released data from 2013. So they're supporting this movement. That's the good news. The bad news is we're not really using it. A Kaiser report about a month ago said that 9% of Americans had tried to use any price transparency tool. So we're low in our adoption, even though the data are out there. Now, as we've been pushing consumers for the past decade, we've also noticed something that is on the verge of changing, right? Healthcare passed in 2009, was launched into the market in October of 2013. It got off to a rocky start with healthcare.gov, did not create a stellar consumer experience, yet over time, some 10 million Americans signed up for the public health plan. Today, some of the state plans are having trouble. We're unsure about what's going to happen with King versus Burwell. But that's on the public side. Let's put that to the side for a minute and think about what also has happened on the private side. A couple of years ago, entrepreneurs began to see that there's an opportunity to get more people focused on buying health insurance in different ways. And about a dozen or 2 dozen private exchanges opened. In 2014, 3 million Americans signed up. Last year, we had 6 million. The projections are to go from 3 to 6. Some people say 20 by 2018. We've heard projections as high as 40 million consumers going online to buy private health insurance. For us, this is what we call a megatrend. And the first of 3 megatrends we're going to talk about today. As consumers begin to shop for their own health insurance online, a couple things are going to happen. One is that employers are going to see this as a trigger to begin to release themselves from the burden of managing the health benefit process. So as employers begin to pull back, here's an opportunity for health plans to do more in how they connect with individuals as consumers, to begin to offer more services. And in time, they won't just buy the health insurance product, but we'll be looking for ancillary products. We'll be looking for other e-commerce opportunities and ways to promote health interactions through that channel that is created between health plan and consumer. So for us, we see that as a huge tipping point that is not happening at this moment, but will in the next short period of time and will snowball over time. So that's what we see as a first mega trend in driving consumer power in this market. As that consumer power begins to shift, and as consumers begin to feel more confident in how they can buy products and services, how they can evaluate and rate products and services, and as they begin to focus on the demand side, we see this opportunity for demand creation to reshape the healthcare market. And I wish that was my idea, but there's this wonderful report from Oliver Wyman called The Patient to Consumer Revolution. It's a fantastic analysis of some of the key trends that are happening today. And their view, one of their headlines here is, demand creation reshapes markets, and demand creation in healthcare will reshape this business. So we have to watch out for that. We have to be cognizant of what consumers are able to do in this market and how we as health plans need to shift our attention, not just to minor adjustments of rewriting the letters that go out to them, but to revamping our approach to how we reach out to consumers. Because this move from supply side domination to demand side influence is significant, and we see that as a second mega trend, that demand creation will reshape this market. Now, we talked about the consumer experience of being on the healthcare exchanges, and even on the private exchanges, it today no way resembles what Amazon experience, TripAdvisor, or Yelp experiences might be. But let's think about this idea. How long will it be before Amazon begins to offer health plans, or TripAdvisor begins to evaluate hospitals, or Yelp begins to evaluate physicians? That may be here sooner than we know it. In fact, this morning I was upstairs at one of the sessions, and Dr. Ray Hockman from Providence Health Plan said that they are so focused on digital interaction out there that the last 10 hires they made were folks from Amazon. So this is shifting the mindset, not just from the vendors that are supporting our health plans, but from the health plans themselves. And we see that health plans must find ways to make things simpler and easier for consumers to interact with them and begin to build trust. So as they have a better experience of the health plan, as they begin to have more choice in how they have options with their not only plan selections but other areas, they can begin to generate trust in their health plan, something that today is near the bottom of the list of companies that consumers trust. So we have some views on how this can play out in the consumer market and the health plan space. We have some recommendations on how health plans can build trusted relationships with their members. And a lot of this discussion around the exhibit hall and in the meetings upstairs is about member engagement and how do we become consumer-centric. So here are some prescriptions. If we begin with the idea that the member that comes on is a customer of ours, somebody that we need to help attract to us, and somebody we want to try to retain over time, let's find the right ways to onboard them. I mean, how many times do you get a welcome kit, maybe 6 weeks after you've signed up, or it's a PDF you can download from the website? We need to find ways to really shake their hand. Think of how car dealerships engage their new buyers and how they'll call, make sure the experience is a quality experience, help rate us on a top to, 1 to 5 scale at the top. Find ways to use experiences from other industries and apply them to our ability to onboard members and to also prepare members for what their experience is going to be with working with the health plan. The better we can prepare them for that experience, the better opportunity we have to forestall problems they may experience as they go ahead and use the service. Digital interaction, a core component of what we at HealthX do, and a critical roadmap element for this industry. Most health plans today have portals that they can use, that their members can use, yet very few have significant adoption levels with those portals. We need to find ways to get members connected at the start. Get them to sign on to the portal, register for it, and give them a reason to go in and use it. Give them more value. And the more opportunity we have for digital interaction with individuals, the better chance we have at managing our administrative cost and giving them an experience that is positive and rewarding. Financial payments, there are companies here that also support that arena. Health plans need to find ways to accept payments online for premiums and other services that they have to offer. It's a natural part of most online transactions, and health plans are moving that direction but need to accelerate. Member services. In most health plans, it's still focused on the telephone and the paper that comes in your mail. We need to help give health plans that 360-degree view of the consumer, let them use IVR technology, let them focus on digital engagement, let them find ways to talk to us and interact with us that don't require a telephone, that don't require an EOB to be mailed to them. Member services have been in these silos where the call center gets evaluated based on how well they perform. They need to think about de-siloing that and find all their member touch points and create an integrated communication spectrum. And then health improvement. I mentioned that wellness is on its way down in the employer sector. At least that's my view. It's at least trending flat. We see opportunities for health plans to do much more in connecting with their members and perhaps taking some of that responsibility away from their employer customers to oversee not only case management and disease management, which they are pretty proficient at, but focus on care management, wellness and prevention and other areas, and be more proactive. Health plans have the data, they have the connections with the members, and they have a vested interest in reducing risk. So that's a significant area of opportunity for health plans to do more with. As we see the market changing, the market shifting, some of the dynamics that are discussed here, we see the health plan of the future having a number of elements. So we mentioned more active promotion of health and wellness. Again, if health plans can get members to take better care of themselves, their risks should drop, should be a win-win situation for both parties. We want to see more engaging, data-driven messaging and interactions, not just text, but there are many other ways to convey data on smart devices, convey messages, let people understand what's available to them or how they should respond to something that's offered, or maybe a follow-up to an event that has occurred. Find ways to do that through the data. We all know about big data, yet we're not necessarily moving it to the individual in the way it can be. Lower left, driving action on gaps in care and chronic care support. So again, picking up on the digital connections and finding ways to move messaging out to the consumer so that they understand what gaps in care they can fill. And to the point about there being a driving force in patient-provider collaboration, let's send dual messages out. Let's reach our consumer/member with a gap in care message and reach their provider with that same message so that we can create that connection. And we certainly see that patient-provider collaboration as a core strategic element of the future, one where we're spending a lot of time on currently. And in the end, we really feel that there's an opportunity for health plans to be a consumer partner in health and healthcare. For many years, health plans viewed members as costs. They call us on the phone to ask us questions. That's a cost. We've got to shift the mindset and say they are a customer, they're a profit center for us. If we serve them well, they will serve us well, and we can create a win-win outcome. So those are some ideas we see about what the health plan of the future represents. At HealthX, we're really focused on this market. Just to recap the thoughts I have on the major trends that we're seeing that will help drive this industry. The first is the growth in private exchanges and how that's going to shift the dynamic with employers and begin to set the stage for consumers to be more active in their choice of products that they purchase, in their trust of the plan and the experience that they have. Second idea is around how demand creation will reshape this industry. And the third is that we have to watch out for new entrants. We have to look out for the next Amazon that comes in. He might come in under a name like Oscar and reshape the industry, or he might come in under a name like Google, but there are a lot of folks investing a lot of money in this industry, and we've got to find ways to serve our customers, our members as health plans, and do so in a way that gives them that value proposition, gives them a digital experience, and creates a reason for them to want to participate in that plan over time. And so that's our story on consumer power. We invite you to visit us at healthx.com or come see us over at booth number 1329 where we'll be for the balance of the day. And with that, I thank you for your time and attention.